a new initiative to save 100 million lives globally through simple interventions such as cutting down on salt and banning trans fats, as well as getting countries prepared for epidemics like Ebola, is being launched with $225 million of philanthropic funding. At the helm is Dr. Tom Frieden, former director of the Centers for Disease Control (CDC) in the United States and in charge of health in New York City before that. Frieden, with then Mayor Mike Bloomberg, pushed through a public smoking ban and other tobacco control measures which slashed smoking rates in the city and increased life spans. At CDC, he tackled tuberculosis, swine flu and Ebola. The latest initiative has two distinct aims. One is to cut deaths from heart disease and stroke through three simple measures: reducing sodium intake worldwide, banning trans fats from foods in all countries, and getting people with high blood pressure on treatment. The other is to help low and middle-income countries prepare to deal better with the inevitable epidemics he says will come along, from flu to Sars. He left CDC asking himself what he could do that would save most lives. With a kind of unique privileged perspective, having been CDC director for 8 years and working in global health for more than 20 years, I was able to identify a couple of areas which I believe are really at a tipping point, where there's been a lot of good groundwork. There is a very strong set of policies and tools available, but they are somewhere between stalled and moving very slowly right now, he told The Guardian. Frieden is not aiming to bypass the World Health Organization, WHO, which was heavily criticized over its handling of Ebola. He says he is a supporter of the WHO, which he worked for in India on secondment for some years. The work will support what the WHO, and the World Bank and the CDC and national governments are doing, he says. There were calls for the WHO to be scrapped, and although Frieden does not agree, he believes it does need help. I think it is crucially important that we support the WHO, but I also think if the WHO is not able to deliver, we can't fail the people who need the service, he said. We do see the WHO as a crucial part of the solution here, and we'd like to see them become more effective than they are now, but by doing this from a non-governmental sector, we are able to move very quickly and very flexibly.